Boa tarde, pessoal. Vamos voltando do almoço. A gente vai ter palestra agora em inglês. Se alguém não pegou ainda o fone e for querer tradução, por favor, pegar o fone, tá bom? Vamos ter agora... outro aviso importante também, para vocês pegarem os certificados, tá? Os certificados lá na frente, com o Júlio. Por favor, se alguém não pegou... Então, vamos dar início à mesa Desafio à Saúde pelo Clima, iniciativas da Rede Global, Hospitais Verdes e Saudáveis. Vou chamar ao palco agora Jaquelina Tapia, gerente técnico de programas da Healthcare Arm para a América Latina, Rede HVS na América Latina. Azeeza Rangunwala, Gerente de Projetos Sênior na organização socioambiental, groundWork e Rede HVS na África. Alessandra Cristina Azevedo, gestora do Desafio de Compras Sustentáveis e do Projeto Plásticos no SHS. E Vital Ribeiro, arquiteto do Centro de Vigilância Sanitária da Secretaria de Saúde do Estado de São Paulo e presidente do Conselho do SHS. Okay. And the pointer is this, if you need to point.
Olá, boa tarde.
It's not working because...
Um aviso, quem precisa de tradução, pode pegar o fone enquanto a gente ainda está começando. Vamos ter palestras em inglês. Como a gente não tem tradução de espanhol, então as palestras vão ser todas em inglês. Menos a da Alessandra, óbvio. E eu estou muito contente da gente estar chegando nesse momento do nosso seminário. É hora de fazer um balanço do trabalho da Rede Global Hospitais Verdes e Saudáveis, dos parceiros, que a gente tem um carinho muito grande, porque já é uma longa trajetória, né, que o Projeto Hospitais Saudáveis trabalha junto com o Saúde Sem Dano, que vocês conheceram vários representantes aqui, vários membros, né, os diretores do Saúde Sem Dano. Houve um tempo em que a gente tinha sempre a Verônica, que fazia a coordenação da América Latina, agora a gente está trabalhando com a Jaque, o Josh, que é também da direção global, não pôde vir, ele teve um problema de saúde na família, mas a Jaque vai fazer a parte do global também, e a gente está com a Azeeza, da organização groundWork, que é muito forte na África, trabalha com toda a região, e, assim como o Projeto Hospitais Saudáveis, eles representam a rede global na África. Esse momento é muito legal, porque a gente faz esse balanço, a gente tem essa visão geral. Eu acho que é um bom momento também para a gente conhecer os diferentes trabalhos que são feitos em vários países, e, através desse conhecimento, a gente despertar um pouco para as possibilidades, não é? Para a importância do trabalho que a gente faz, de como a gente está nessa lógica de, através do setor saúde, na verdade, está liderando uma grande transformação na sociedade, na economia, enfim, levantando a nossa voz aí para promover uma série de questões que a gente entende muito importantes. Para, então, começar, e claro, na sequência, a gente vai fazer uma série de reconhecimentos, não é? Vamos ter o anúncio do Prêmio Global de Clima, é um anúncio antes do anúncio global. Na verdade, a gente vai anunciar os ganhadores do Brasil. A divulgação do Prêmio Global de Clima está prevista para sair a semana que vem, então vai ser uma prévia disso. A gente vai aproveitar a oportunidade para anunciar os ganhadores do Brasil, e a partir da semana que vem vai ter uma divulgação mundial desses ganhadores com todas as regiões do mundo. E, na sequência, a gente vai fazer o reconhecimento dos desafios do Hospitais Saudáveis, que são os desafios de clima, energia, compras e resíduos, que vocês já conhecem. E é essa hora em que a gente faz também um balanço, uma comemoração, um reconhecimento do trabalho que boa parte de vocês aí ralou muito ao longo do ano para completar, não é? Então, todos que completaram esse processo vão ter esse reconhecimento hoje. Para começar, eu vou chamar a Jaqueline. Você vai começar pelo global, não é, Jaqueline? E depois já emenda com América Latina, já segue com América Latina.
Yeah, I'm going to present some part of the work that we have been doing with global and LAC, but the integration of the work actually, because the work that we have been doing in these years is an integration of the team that is in the global, that is part of the global team and part of the LAC team. So yeah. And there our initiatives more local that are from the region, from Latin America.
Perfeito. E se vocês quiserem fazer perguntas, podem aguardar o final da fala da Jaque. Da Azeeza e da Alessandra, a gente faz as perguntas em conjunto, porque eu acho que vai ser melhor assim, elas podem responder juntas, não é? Azeeza, você está com fone? Ah, perfeito. Great. Então, vamos começar, por favor?
So, there. I'm going to say that this is going to be more easy if I can speak in Spanish. This is, I think, my first presentation in English, so be patient, and I'm apologizing in advance if something is not understood. You can raise your hand and ask me questions, of course. We have seen this in another session that one of my colleagues was presenting. This is the global network that we had developed and that we are working. We have more than 2,000 hospitals that are part of our global healthy network. These hospitals are worldwide. We have regional offices in different parts of the world, and we have strategic partners in different parts of the world. We have more than 2,000 members that are part of the global network. But especially, I want to present this in this slide. The quantity of members that we have in Latin America. We have more than the half of the members that are part of the global network, and this for us is a unique opportunity and an enormous challenge, and of course, a big opportunity to work together with hospitals, with health organizations, with health systems, with health professionals, to work in this transition that we are looking for, that is to advocate for a more healthy healthcare, sustainable healthcare, of course, to reduce our environmental carbon footprint and our environmental impact. So I think this is, for us, a great opportunity to start working together in the region, different hospitals, align our interests, our objectives, because we can make the change. We have to work in understanding that not only we can heal people, we also can heal the planet if we work together. So this is something that also we have shared. We have shared in another session, but I think it's important because the work we have been doing, it's related to these priority objectives, these priority areas, and the crossing point that we have, we can find here. We have developed a strategic plan that is 5-year strategic plan where mitigation, adaptation, and plastic pollutions are our strategic areas, and those strategic areas are going to be worked with the power of our global network, with the professional network that we have been building, and also with the journalists and the communicators, and of course transforming the supply chain that is a work that we have been doing since 2018. And these are, I will say, some of the initiatives that we have been working as a global team, as a LAC team in the region in Latin America. One of these initiatives is attached. I think that you have heard Maria Riva yesterday. She mentioned this initiative that was is a starting point where healthcare without harm is a partner of the UK government, and we are working together with them in promoting the use of tools and so governments can develop national, regional, and local plans to I will say, accomplish with healthcare systems that are reducing emissions and sustainable healthcare systems, of course. We have, I think, in this moment, we were part of the COP26 and partners in the health agenda of the COP26. And in that moment, there were 52 countries that were that assumed the commitment of being zero emissions, and in this moment we have 82 countries, and we are advocating for more countries to be part of that initiative. We are also been working and have been working with national governments, in case of the Colombia government, in the case of Ecuador government. We have been assessing them in the calculation of the carbon footprint of the healthcare sector, especially with the government of Colombia. Healthcare Without Harm signed an MOU. This is in order to calculate the carbon footprint of the health sector. And this was done by 3 activities that has to do with to construct I would say muestra, a sample, thank you, a sample of hospitals that are part of the health system of the health sector of Colombia, training those professionals that are part of the health sector and accompanying the health professionals and the hospitals to report and monitoring the missions of the health sector. And that information was used to create a plan to help the government of Colombia to have a plan for the middle and long term. And this year, I think it was in August, we have launched the same activity with the government of Ecuador, where 31 hospitals are being training to calculate the carbon footprint of the health sector of Ecuador. We have also developed a carbon footprint tool that is especially designed for healthcare. It's called Checkup Tool Calculator. And we have developed a training course that has been developed especially for health professionals, for hospitals, for health systems, and that has the objective that health facilities to know where are the emissions and to act in order to reduce their emissions. This is a free course that is part of the tools and the resources that we offer to the members. And we, of course, are partners of the health of Race to Zero. I think there are more than 70 countries that are aligned with this initiative, and they are working in reducing their emissions. And lastly, but not less, recently we have launched this care that is comunidad. Let me see, I have my notes because I can't remember everything, so I'm so sorry for that. This is community for action. Thank you. I have it in Spanish, so I'm so sorry for the time. Comunidad de Acción para la Reducción de Emisiones. Thank you. That is in Spanish. So that is an initiative that in some ways trying to concentrate health professionals to collaborate and exchange experience in order to encourage the health professionals in learning experiences related to reduce of emissions in action and health. So that's the work that we have been doing related to that part of the work that we have been doing related to climate. This is part of the work that we have been doing related to sustainability and especially for plastics. Since our participation in the INC4, we have developed open letter for professionals that the people that was part of the panel where Alessandra was presenting. This is an open letter that health professionals are addressing to the delegates of the countries that participated in Global Plastic Treaty, and that it is advocating for a fair global plastic treaty where the full cycle of the plastic is considered. But not only that, we are advocating for a plastic that should not leave the health sector exempt. In fact, the World Health Organization has raised that and has said that the health sector cannot and should not be exempt of this global plastic treaty. We are advocating for a plastic treaty that should detoxify the sector, that should eliminate the single-use plastics products that are not necessary, that should be concentrated in human rights. And there are more than 1,000 of professionals, health professionals, that had signed this letter, that are part of 76 countries, and there are organizations that are representing 6 million of the interest of 6 million of professionals that have signed this letter. So this is a work that we have been doing and we are still promoting, because we are going to be part of as observers in the INC5 that is going to be in Seoul, in Busan, in Korea del Sur, now in November, and we are sharing this information with all the professionals, with all the organizations that are part of the health sector, because we want that this treaty, that the health sector be part of this treaty. We have also been working in spreading information related to the plastic treaty, and in that sense, we have been working with stakeholders that are, I would say, that are strategic stakeholders in the region, journalists and communicators, because it's important for us that this information not only has to be, that not only we have to share this information with health professionals, but we have to form our journalists, our communicators to be part of this strategy and to advocate for this treaty also, as we are doing. Finally, we have a lot of documents, resources, and develop a lot of guides that in some way is presenting the information of plastic and health. We have a panel of plastic and health. It's important. It's a new challenge. It's related to climate change. It's impacting the health. It's impacting the environment. So we have to work in that sense and commit with all the health professionals and all, of course, with the community in general. And lastly, we have been working recently in a project that is financed by the Norwegian retailer Environmental Fund. That this is a pilot project, in fact, that is happening in 4 hospitals of different regions: Colombia, Brazil, Philippines, and the UK. And this project has the objectives of being a pilot to generate a model that could be scaled to the other members, and with the single objective that is to evaluate the disposable textiles for reusable textile. In fact, today we have experiences of hospitals that are changing the disposable textile for reusable textile. What we want to do with this is to generate that model that could be scaled for all the members of the network that we know that are not few members. Related to the local initiatives, this is the part of the work that we have been doing with the global team and the regional offices, of course, and the Latin American office or the Latin American team. In this case, we have, I'm presenting here initiatives that are local initiatives, regional initiatives that has to do with plastic, but with advocacy of plastic, especially with hospitals and with professionals of the health. This year in particular, in the international context of the Global Plastic Treaty, we have been working and developing a roundtable related to plastic, where more than 30 hospitals are part of this table, and where we are, those hospitals have been working in reducing, in the elimination, in the substitution. Even they have been working with the providers, with the suppliers, to redesign the products that they are buying. So we want with this to generate information because we are part of those negotiations as observers, but we need to present the information that is happening in the region, because we understand that most of the definitions are taken with information that is generated in the north of in the countries that are part of developed countries. In this case, we want to generate information, and we want to present information that is generated in the global south, because the decision has to be made, has to be taken considering these cases, of course. And we have a lot of experience of hospitals that have been carrying out initiatives that are important and that we need to share with the country of the north, where the decisions are being taken. Lastly, related to despite this is not, I will say this is not a strategic area. We know that in the region we have a clear challenge that has to do with waste to energy, with false solutions. So we have been working that the members of the hospitals ask information related to chemical recycling, to the recycling of PVC. We have seen in other presentations that these are false solutions, that these are old technologies that are being presented as new, as a good alternative for the treatment and management of waste. And in this case, we have been working with Gaia, with Break Free from Plastic, even with PHS in the presentations of technical information for hospitals that need that information to take the decision, more conscious decisions. And this is a local work, of course. We have been working, this is the type of work we have been doing. We have been working with hospitals, in this case with 4 hospitals of the Minister of Health in Chile, in the Región Metropolitana de Santiago, to characterize and quantify the single-use plastics that are generated in the food services, and the EPP and other plastic that we understand that they have sustainable alternatives. So this project was carried out last year, and this year this project that was for 4 hospitals is now a strategy for the Minister of Health, and there are 72 hospitals that are working in the characterization and the quantification of the EPP of the plastics that are generated in the food services, and they are reporting this information as part of the management of the hospitals to take better decisions in the process of procurement and in the management of waste. So this is the kind of work that we do. We work with pilots, and then we try to scale this and transform that project in a strategy for a minister, for a health system, for a municipality, for a local government. We have been working, of course, in procurement, in sustainable procurement. I said before, since 2018, as part of and together with UNDP, and part of in the framework of SHIP project, that was a project that Sustainable Health Procurement Project. And we understand that once that project finalized, we understand that in the region we have a huge opportunity to work with health systems and to work with hospitals in developing and in the integration of sustainable criteria as part of the procurement process. So the last few years we have been supporting the capacity building of the professionals that are part of the sustainable committee, of the procurement committee, because we understand we have this opportunity as a region where the hospitals and the health systems can demand together the transformation of the supply chain, as we have here yesterday. The supply chain is responsible for most of the 75–80% of the emission of the healthcare, of the emission of the health sector. We have this local initiative, of course. We have our local conference, regional conference. The last year was in Colombia. We did it together with the Red Hospitalaria. And this is a place where hospitals, where leaders and lideresas and referents go together and exchange information. And we understand this is the moment where we show the leadership of the region in working to reduce their carbon footprint, and they are working to reduce their environmental footprint. This is the moment where we show and we organize this in order to the participants can exchange those experiences and present and of course share and socialize all that information. I said before, we have different resources, guides, and documents that are in our website, that are in Spanish, that are in English, and I think they are also in Portuguese. And we share with the members tools that they use to control and follow up their objectives, to report and to monitor their plans. I will say this is for hospitals that time out. I'm finishing. This is for hospitals that they want to improve their environmental management. So we share with them different tools that are used in that way. This is the hospital that Hospitales que Curan el Planeta reporte. This is a report that we have been publishing since 2017. This year we are going to publish the 8th report. And I will say that this report, in essence, is a report that share and socialize the different experience of the hospitals of the network. And in some way, it's a way that we can show how the health sector is committed to reduce the environmental footprint, to reduce the environmental impact, and to show that we not only work to heal people, we also are working to heal the planet. So this is an initiative that we have. We share with, of course, with our members. I'm finishing this local initiative as Projeto Saudáveis tiene, that is our initiative of awards, Menos Huella Más Salud Awards. There's a graphic where you can see the postulations along the years, and I think that that's showing how hospitals and how the health sector is committed with this objective of working together in reducing the environmental impact. We have different categories that are recognized, that are awards, and that's and I think that it's a good initiative to recognize this work that hospitals has been doing in order to their commitment. And finally, of course, we have been working in the communication and in the information. The information and the communication is important. We have heard yesterday that not everybody knows the relation and the links that we have that health and climate change has, or that health, climate change, and plastics has. So it's important for us as organization and for you as health professionals or people that is taking decisions in healthcare facilities to be informed, because the decisions have to be made conscious about the impact that the health sector is generating, is having, and in that sense we have been working to engage journalists, principal and communicators, and of course health professionals in order to use them as allies of our message. And I think that's all. I'm really sorry for my English, but I'm open to questions.
Azeeza, por favor.
Good afternoon, everyone. I'm sorry that I don't speak Portuguese, but I'm from South Africa. Can we put up my presentation? I'm the Global Green Healthy Hospitals Coordinator for Africa, based in South Africa at groundWork. groundWork is an environmental justice organization that is the partner of Healthcare Without Harm. And I'm glad Jaque gave us the global context, but we also work globally with policy because we have a shared goal. But we do have some regional differences, but also some regional similarities. Move over to presentation. Oh, I have it. Oh, there we go. Oh, it's great seeing my presentation in another language. So in the African context, we find that the health system is also as sick as the patients that go to hospitals. We have three things. We talk about access. So it's about access to essential services. And then we also talk about quality of care, of essential health. And then we also speak about now in the climate about resilience of the provision of health services and health-related services. And I think the resilience of the health system was tested gravely during COVID-19. So in the context of our sustainable development goals, we do have the lowest life expectancy in Africa. Now, Africa is quite a big continent with over 50 countries and very diverse, and every country has a different way of how the health systems operate. And in some countries, it's almost impossible to imagine health, so never mind imagining sustainable healthcare. We have social, structural, and political determinants of health that determine the quality and the access and the resilience of your health system. So more on the regional context is that we're looking at how the African healthcare systems are increasingly experiencing climate-linked emergencies. And the climate change affects the social and the environmental determinants of health. Your basics such as clean air, safe drinking water, sufficient food, and secure shelter. And another basic we don't talk about is the basic of joy. Someone mentioned, Victor mentioned this morning that his 9-year-old has climate anxiety. So climate anxiety strips people of joy, and joy is a basic. We need joy as much as we need food, water, and shelter. So in 2023, we had extreme weather events that killed more than 15,000 people in Africa. Now, there are also droughts that are affecting more than 88 million people across 6 African countries, according to WHO data. As of September 2024, 22 countries have national health adaptation plans, and less than 20% of the countries have health mentioned in their nationally determined contributions for reducing greenhouse gas emissions. So we have water problems in South Africa, and in 2018, we were undergoing a very extreme drought. So this is pictures from the Western Cape. It's about 200 kilometers from Cape Town. I know many people know Cape Town in South Africa. And this is the state of what the dam looked like. And the dam was completely dry in that year. So they were talking about day 0, that the city of Cape Town would run completely out of water if we don't mitigate or have actions in place to have water. And desalination is very expensive, so we have a great coastline as well, but that was not even an option. In the very same year, not far, like 400 kilometers away, or like a 3.5 hour drive in George, flooding took place. In the same year, not far from where the dam was completely dry. So as you can see, we are suffering, we are deep within the climate crisis, and the health system had to be the first responder. So in Africa, in context of global green healthy hospitals, our membership is not as high as Latin America. You're doing very well with membership. Our members are mostly concentrated in South Africa, but as you can see, we have about 124 members in 11 countries. I am based in South Africa, and I think that is why the membership is a bit skewed as well. So our hospitals are expected to actually work with the resources they have to try and align to sustainable practices. And oftentimes people think, well, sustainability is expensive and moving away from certain products is quite expensive, and that's a talk that we usually have. However, I'm going to talk a bit, just give you a little of a snapshot of the type of initiatives that we do have. So Shefa Al Oman Hospital, which is in Egypt, which is very much north of Africa, they have over 1,200 staff members and 150 beds, but they also have high energy consumption because they are based in the desert and it's very hot there. So they had hefty operating costs and very much negative environmental impacts. So the electricity sources in Egypt is 90% from fossil fuels. So the carbon emissions that they actually managed to reduce was over 261 tons of the carbon dioxide equivalent that was achieved between October 2022 and March 2023, so less than a year. So the other members that we also have in South Africa have looked at investing in solar energy, and they've also invested in solar energy because of the term load shedding in South Africa. So load shedding, we've had lots of power outages in South Africa. It's getting better now. But in the past year, there would be 4 hours of no electricity in the morning, 4 hours of no electricity in the evening, like morning, evening, and sometimes 6 hours at a time. And that would become extremely frustrating. And the healthcare system was not, there was no exception for the healthcare system. So you can imagine what it is like to deliver healthcare when you do not have power. And the health professionals, are working under extreme, lack of resources, and they also suffer from burnout as well. So that was probably why there was a push towards renewable energy, but the renewable energy project actually showed to reduce the emissions significantly, because diesel generators actually meant that diesel is very expensive and has very high emissions. So the other adaptation, I spoke about day 0 earlier and showed you about the drought. Within that year of the drought in 2018, we had commissioned a new clinic, District 6 clinic, and they thought we need to adapt to our water management. So in Cape Town, South Africa, they actually put in rainwater harvesting so that they do not have to rely on the municipal water system, and to build water resilience and to maintain the clinical operation amidst intense drought. Because we know you can't deliver healthcare without electricity, but when there's water, there's no basic sanitation either, never mind healthcare. So when they looked at the rainfall statistics, because you're also dependent on rain for rainwater harvesting, they managed to have about 4.1 milliliter rainwater into 1 kiloliter. And eventually they actually managed to have 21% of the total consumption move towards the clinic. It doesn't sound like a lot, 20%, but it actually makes a big difference. So that's how they've tried to be resilient and also mitigate for these actions. And then we have healthcare waste. Now, healthcare waste is usually often my favorite topic, because healthcare waste is your low-hanging fruit, and I think in the plastics session we saw an interesting video of how much plastics comes from surgery, and we often don't think about it. We think laboratory waste. I used to work in a laboratory. I'm a medical scientist. We just dispose of the gloves all the time, and we want to ensure aseptic technique, ensure that you're working in a sterile environment, and you think it's more sterile to work with more plastic. But that's not often true. So what we find is that healthcare waste is a major cost driver for health facilities. One of the biggest hospitals in Africa is in Johannesburg, and they produce 2.6 tons of waste per day. And that is a huge cost driver, because they're actually the biggest hospital, I think, in the Southern Hemisphere as well. So the service providers have to transport the waste, and then they have to treat the waste, usually by incineration, because incineration is widely used. And incineration is actually such an old form of technology. We're living in the age of talking about things like artificial intelligence, and we have high-speed internet, yet we're still incinerating. Just doesn't make sense how we develop and also not progress. So we're looking at things like service interruptions when patients, visitors, and animals are exposed to hazardous waste. So several hospitals in South Africa specifically have installed on-site treatment technology moving away from long transportation routes and incineration, because if you're incinerating on site, you are making your patients sick. So we're trying to not make your patients sick, and we're looking at prevention is outside of the hospital system. Because how do you reduce your carbon footprint as a hospital? By having less patients. So maybe private would want to make money and have more patients, but public healthcare facilities, you want less patients all across. So this type of treatment technology, as you can see, is on-site, no emissions at all, but it does use water. But we found out that you can recycle the water, and as you can see from that photo, you'll see that it's shredded over there. You can't identify the waste anymore. It's using frictional heating technology. Some use chemicals, but that also you have to wait to ensure that there's no false solutions. And then the last one is, we're looking at how hospitals can also improve their own reliance on, not relying on their supply chains for food. If there's space, why not have your own food garden? Ensure that patients have access to organic fruits and vegetables. Oftentimes you find that a lot of HIV-positive patients are taking medication, and in order to take the medication, they have to eat. But as we know that starvation, malnutrition is rampant right now, and since COVID, the cost of living has skyrocketed, so people cannot afford food, but they need to take medication. So these hospitals have successfully grown their own vegetables. This is Polosong Hospital in Johannesburg, and they've given it to HIV-positive patients that come and fetch. They come and fetch their medication, and they also come and fetch some fruit and vegetables. So in addition to this, we were looking at regional scaling, because instead of having a continent-wide conference, we went to Zambia in 2022, and then we went to Kenya in 2024. Kenya have signed to the Attach program, but they have maybe missing the implementation part of sustainable healthcare, whereas South Africa has not yet signed to Attach, but they've done the implementation. So we're working with all these various moving parts of how health systems operate. And then there's also this Climate and Health Network of Africa called CHANCE, and that is where we actually work with CHANCE to scale regionally, because when we're working as a group for climate action, we have to use the networks we have and get the reach that we can. So we're also working on a MOU, a Memorandum of Understanding, I hope it's not lost in translation, with South Africa's Ministry of Health, and looking at inclusion and focus of health in the just transition. Just transition is a very big topic in South Africa, because we're very dependent on coal. We're trying to move away from coal. And people in the coal areas are actually fighting against health effects of the air pollution. groundWork actually took the Minister of Environmental Affairs to court and won the case in what we call the deadly air case, because we have proved that all the coal-fired power stations are actually causing illness in kids especially, and the elderly, and there's data to prove this in the region. So we are waiting for them to actually ensure that there's compliance to the minimum emission standards in that region. So beyond that, we're looking at adaptation is a priority for our region, although mitigation has co-benefits, and that we need resources for climate resilience, to be optimized in healthcare settings so that we can meet the existing health needs as well as adapt to threats. Because we might even see more pandemics. We might, South Africa does not have malaria yet, but we are seeing mosquitoes move to South Africa. And that's, there's just vector-borne and zoonotic diseases will change as we go. And health professionals are very important. We also do health professional training. Unions are very big in South Africa post-apartheid, so we are using the unions. We have the biggest nursing union as a global green healthy hospital member, and we are making sure that the nurses are capacitated in what we talk about pollution, climate, and the environmental and social determinants of health. And I'm going to end there, and just, very much excited to engage on the topic further. And if we meet afterwards at tea, we can use Google Translate, conversation mode. So we can communicate either way. Thank you very much.
Posso já fazer a transição agradecendo, Jaquelina. Esperar a Azeeza colocar o fone. Obrigada, Azeeza, muito bom. E vocês sabem, né, todos sabem, o PHS é o parceiro estratégico da saúde sem dano no Brasil. E então a gente trabalha bastante próximos, né? Nós temos e é muito bom porque cada vez mais a gente tem tido oportunidades e a necessidade realmente de trabalhar conjuntamente. Então tem sido bastante bom, tanto na agenda de clima e plásticos especialmente. A gente estava conversando agora há pouco também sobre como a gente pode definir os nossos planos, né, regionalmente também. A gente tem uma oportunidade muito grande. E é isso, né? Então o foco da nossa apresentação, o Vital mencionou. Verdade. Fazer um balanço do que a gente está fazendo no Brasil, depois o Vital também me complementa, e na sequência a gente já vai fazer também o reconhecimento dos membros que participaram, um balanço do ciclo do 2024 do nosso desafio, dos desafios PHS. Então, essa é a nossa rede. Então, aqui no Brasil, o PHS, como parceiro estratégico da Saúde Sem Dano, a gente fomenta, a gente tenta engajar que mais e mais organizações de saúde façam parte da rede global Hospitais, Verdes e Saudáveis. Atualmente, são 349 membros institucionais, hospitais, unidades de saúde, 23 sistemas de saúde representando mais 400 hospitais e 1.000 unidades não hospitalares, mais de 1.000 unidades não hospitalares, e são distribuídos nacionalmente. Então, a gente tem essa atuação nacional, crescendo, né, Vital? Esse número a gente até tem a dificuldade de atualizar também, porque ele está sempre crescendo, esse número, além dos profissionais individuais também, que se conectam à nossa rede e que também, cada vez mais, têm nos apoiado. A gente também fomenta a campanha Race to Zero no Brasil, como elas mencionaram já. A gente é uma campanha que estimula que as organizações definam suas metas para a redução das emissões até 2030, 2050. Não só metas, mas também definir planos, ações para que a gente consiga realmente minimizar esse impacto. Atualmente, a gente contribui, né, com o número da rede global com 8 hospitais e 2 sistemas de saúde. Aqui tem a lista para vocês. Aqui vocês conhecem um pouco mais as agendas que a gente trabalha aqui no Brasil. Vocês sabem também que a Saúde Sem Dano tem 10 objetivos, a agenda global da Hospitais Verdes e Saudáveis tem 10 objetivos. Aqui no Brasil a gente trabalha as 4 agendas: Clima, Resíduos, Energia e Compras, que são os guarda-chuvas para todas as atividades que a gente vem desenvolvendo, ou seja, a própria ferramenta do desafio que vocês utilizam para a gestão da informação, gestão dos dados, desenvolver os recursos, as ferramentas adicionais, enfim, todo o apoio, toda a assessoria, ela está em torno dos desafios. A gente tem feito um trabalho bastante bacana, a gente tem conversado muito sobre isso. O momento está muito bacana, né, para a gente do PHS, mas acho que essa discussão de clima e saúde, plásticos e saúde, enfim, muito aberta junto ao governo, junto à sociedade civil também, sendo bastante convidada para participar dessas discussões. E a gente está num momento muito bacana com o PHS também aqui tentando cada vez mais estar envolvido nessa agenda mais ampla também de discussão nacional. Mas vocês sabem, o PHS desde sempre também tem essa atuação para tentar influenciar as políticas públicas, defesa de direitos, desde os Mercúrio lá atrás, mas também uma pauta forte em resíduos. E, ultimamente, né, nos últimos meses, nos últimos anos, a gente vem trabalhando bastante forte nessa agenda de plásticos. A Jaque mencionou o momento que a gente está passando, desde 2022, com o Tratado Global de Plásticos. A gente também vem apoiando a Saúde Sem Dano e cada vez mais forte, tentando apoiar essa discussão realmente para que a gente tenha um caminho melhor, né, nessa discussão dos plásticos. E aqui a gente, então, nesse contexto também do nosso trabalho, desse fortalecimento da saúde, nas discussões sobre clima e plástico junto ao governo. Então, isso realmente reforça, fortalece a nossa capacidade de análise, de intervenção e poder de influência realmente no debate nacional, e é isso que a gente vem tentando trabalhar cada vez mais forte. Alguns exemplos, esse ano a gente tem tido a oportunidade de participar, ou apoiar tecnicamente, realmente, mas também de participar de algumas oportunidades de discussão promovidas pelo governo, seja webinários, seminários, presencialmente, virtualmente. A gente, vocês sabem, o Brasil vai ser a sede da COP30, o ano que vem. A gente também, então, está bastante forte. A gente vai ter um representante também na COP29 agora em janeiro, novembro. E a gente sabe que o trabalho só vai aumentar nos próximos meses, porque a gente aqui também vai, enfim, internamente, articulando com organizações e tentando fomentar para a gente conseguir também ter um caminho até a COP 2030 bastante bacana. Articulação em rede é algo que a gente vem tentando reforçar também em todas as frentes. Energia teve um trabalho bastante bacana no âmbito da Rede Kigali, formado com algumas organizações, e aqui a gente, realmente a ideia era que acontecesse a emenda Kigali, né, Brasil promulgasse a emenda Kigali, mas também a gente teve oportunidade, tem tido a oportunidade de trabalhar outros projetos com essa rede de organizações em torno de energia. As discussões também que acontecem em torno do Observatório do Clima, acho que é mais recente aqui a coalizão de organizações que fazem parte, Vida Sem Plástico. Então, são um conjunto de organizações da sociedade civil, de atuação bastante diversa, mas algumas delas, também o IDEC está junto, mas tem várias organizações que a gente vem discutindo juntos em como a gente pode apoiar, mas também influenciar para que a gente tenha um tratado global de plásticos que seja, enfim, que seja, atenda realmente algumas questões importantes e que a gente consiga trazer isso também, uma discussão séria, responsável, e aqui para o Brasil também. Alguns dos nossos projetos, então, a agenda de plásticos, a Jaquelina mencionou, está parte das diretrizes estratégicas da saúde sem dano, reduzir a poluição plástica. Então, a gente está também cada vez mais forte. Tem bastante coisa que a gente vem desenvolvendo, as fichas técnicas, publicações, sempre tentando estimular as boas práticas, mas a auditoria de plásticos é uma ferramenta super importante. A gente já teve a oportunidade de trazer um pouco para vocês, e isso deve ser realmente a ferramenta que a gente deve cada vez mais estimular que vocês utilizem, porque a gente não consegue atuar sobre aquilo que a gente não conhece, aquilo que a gente não mede. Então, é uma ferramenta que vai ajudar a gente a identificar e quantificar o que a gente está consumindo aqui nas organizações de saúde, e pensando que não só como uma referência para nós PHS, porque é algo que a gente vem tentando trabalhar, já é outro ponto, mas produzir informação que seja relevante não só para vocês na tomada de decisão, mas que a gente consiga, com isso, também contribuir com o governo, né, evidências que ajudem na formulação e monitoramento de políticas públicas também. Então, é uma ferramenta super importante quando a gente está falando da agenda de plásticos. O projeto de têxteis médicos, a Jaquelina também mencionou, é um projeto que envolve recursos de um fundo norueguês, a parceria com a Saúde Sem Dano oferecendo o suporte técnico e com os recursos do fundo norueguês. A gente é um projeto que envolve 4 países. Aqui no Brasil a gente tem um parceiro, o Sejam, eu não sei se eles estão por aqui, mas a gente tem um parceiro, e a ideia é um piloto, né? Realmente a gente é um projeto de 2 anos, e com isso a gente está construindo um projeto para ser replicável, escalável para todas as organizações, Brasil e também globalmente. E acho que o outro projeto que a gente também vem tentando estimular é a substituição das luvas. A gente sempre ouve aqui o desafio que vocês têm da substituição, mas a gente vê também cada vez mais organizações buscando a substituição por luvas mais sustentáveis. A inteligência de dados é um trabalho que a gente fez muito forte esse ano. Na verdade, vem fazendo, né, Vital, nos últimos anos, mas esse ano teve uma dedicação assim, além assim, acima do que a gente, enfim, realmente para atingir proporcionar realmente... bom, a gente coleta dados desde 2008, né, dos desafios, então que a gente consiga, a partir desses dados, gerar informação para vocês conseguirem fazer o benchmarking com as outras organizações e, novamente, né, que a gente consiga, com isso, trazer evidências do setor de saúde Brasil para que seja utilizado de uma forma mais ampla também. Fora as melhorias de sistema mesmo, né, de acesso, enfim, todas essas melhorias que a gente vem fazendo para vocês, mas esse é um caminho que é super importante. Outros projetos, então, o projeto Clique, que a gente teve junto com a parceria com o Hospital de Clínicas de Botucatu, para substituição de iluminação de lâmpadas, a própria aprovação da emenda Kigali, que eu já mencionei também, dentro do contexto do Clique, em conjunto com outras organizações enfim, do setor. A gente vem atuando junto à Secretaria de Estado de São Paulo, né, no contexto do Plano Estadual de Saúde, e estimulando, aqui a gente tem uma meta, né, vital de participação de todas as unidades da Secretaria de Estado de Saúde no reporte dos dados, principalmente dos desafios de clima e energia. E aqui também é algo que a gente não quer também limitar a Secretaria de Estado de Saúde de São Paulo, então é um trabalho também que a gente quer mais e mais organizações de outros estados também participando, são parcerias e oportunidades que a gente quer estender para outros estados. E a articulação, como eu também já mencionei, da agenda de saúde e de clima, a COP29 está aqui, daqui 2 semanas, COP30, a gente tem todo um trabalho para fazer. A gente vem trabalhando aqui, Andréa, não sei, acho que ela não está mais aqui, mas a gente vem trabalhando junto com a equipe global, também nessa articulação junto ao G20, a gente teve também a oportunidade de participar, ter participantes. Enfim, está uma agenda bastante forte realmente de articulação nas agendas de clima e plástico. Recursos e ferramentas, então vocês também sabem, a gente está sempre tentando divulgar, disponível nas nossas páginas, um conjunto de ferramentas que vocês podem usar, a gente desenvolve junto colaborativamente com os nossos colegas, traduz, dissemina e tenta implementar com todos vocês. Os eventos que a gente vem realizando, o reconhecimento das boas práticas e a gente não só as nacionais, como a gente vai fazer agora, a gente faz hoje, né, a gente sempre tenta reconhecer nos nossos eventos, mas também internacionalmente, a gente sempre tem cases do Brasil, casos do Brasil participando das publicações promovidas do reporte Hospitais que Curam o Planeta da América Latina ou até da própria UNDP também. Então, esse é um pouco tem bastante coisa, vocês sabem, né, podem encontrar na nossa página. Além disso, também na própria página da Saúde Sem Dano, que tem bastante coisa. E aqui os reconhecimentos, já vou partindo aqui, Vital, para a parte do prêmio do Amigo Meio Ambiente, que a gente fez ontem, o prêmio de Global de Clima, que a gente também vai reconhecer, e os reconhecimentos dos participantes do desafio. Então, eu deixo aqui, agradeço, Vital, não sei se você quiser complementar mais alguma coisa, ou já também, Eric, de repente, já pode daqui a pouco vir aqui para a gente fazer a próxima apresentação.
Na verdade, palmas para todos. Realmente foi um painel um painel que traçou aí uma visão geral, não é? Acredito que tenha sido muito rico, espero. Caso vocês tenham perguntas, a gente tem um tempo para isso. Nossa agenda está apertadinha, mas podem levantar a mão, a gente leva o microfone. A Mariana pode levar o microfone. Júlia.
Eu vou tentar valer todos os anos que os meus pais pagaram curso de inglês para mim. Good afternoon. My question is actually a provocative question. Of course, we understand that Brazil, Argentina, South Africa, as developing countries, have a huge responsibility among their emissions. But I think that in other countries, such as European countries, the USA, they have this bigger responsibility, not only because they have this historical, how can I say, woke when it comes to these emissions, but they also use Latin, African, Asian territory for their industries and their own activities. So my question is, what's your opinion when it comes to their responsibilities that, of course, we have our own, but don't you think they have this bigger responsibility among this agenda?
I totally agree that they have the bigger responsibility because historically they have caused climate change, and that's not a controversial thing to say. The evidence is clear, colonization, we're still sitting with a lot of those effects. I mean, for example, the cataract eye surgery in India versus the UK, in India it's 6 kgs per cataract surgery, and in the UK it's 180 kgs for the same quality of care, except they use single use. And oftentimes they open an entire pack and use 3 things and throw it away. Whereas in Zambia, one of the volunteer doctors told me that they operated on someone's knee, took a pin out, and they sterilized that pin to put it back in someone else's body. So I do agree that, but it's obviously a regional thing where they have to reduce because the emissions are probably much higher, and ours are probably already low in some cases, and that's where we're looking towards adaptation. And after Race to Zero, we're looking at Race to Resilience, that the UN is looking for, those indicators. So hopefully for the Global South, we can also race to resilience, and they can race to zero, hopefully.
Excelente. Mais alguma pergunta? Bom, como a gente está um pouco na hora, eu até adoraria estender um pouco mais essa conversa. A gente vai partir agora para a cerimônia de entrega do prêmio. Eu vou passar a palavra para a Mariana, agradecer aos nossos palestrantes, muito mesmo. Espero que a gente continue. E sugiro que a gente continue com perguntas, etc., depois no coffee break.
Então, enquanto eles tiram a foto, só lembrando, quem for indo para o aeroporto, quem for saindo, lembrar sempre de deixar os fones, tá bom? Por favor. Não vamos esquecer dos fones. E também de retirar os pôsteres. Claro que na hora do coffee break, vocês podem continuar tirando foto, tudo com os pôsteres, mas lembrar de retirar eles, que eles são de vocês, tá bom? Então, agora, fazendo a transição de palco.